New data suggests roughly 1/3 of COVID patients develop a neurological or mental health disorder. These patients received mental health diagnoses within 6 months of getting infected. That's according to a recent study published by the journal Lancet. Here are the most common problems. 17% of patients suffer from anxiety, 14% with mood disorders, 7% say they abuse substances, and 5% report having insomnia. In all, 13% of these patients say it was their first recorded neurological or mental health diagnosis. Let's turn to Dr. Sue Varma. She's a clinical assistant professor of psychiatry at NYU Langone Medical Center. Doctor, thank you. How concerned are you about the long-term impact of COVID on all of our mental health?
I'm very concerned because prior to this, we were talking about the mental health fallout just from the loss and the grief and the economic impact. And now we're going to add to that neuropsychiatric symptoms, as you mentioned, anything from anxiety, depression, but also headaches, tingling, numbness, weakness, fatigue, and what we call brain fog, where a lot of people are saying that I'm having memory deficits. I go into one room and I forget what it is that I came for. I can't remember the names, or executive impairment, executive functioning impairment. So I am very concerned about these symptoms.
We know many people get COVID without ever developing common symptoms at all. It seems possible that some people battling mental health problems could have had COVID and had no idea they had COVID. Is this something doctors are seeing more often?
Yes, some of the patients that actually came to me, only now in retrospect are we putting it together that perhaps they might have had symptoms of COVID that flew under the radar, that were not noticeable, that didn't cause any functional impairment. And get this, the first presenting symptom of having had COVID was anxiety or depression, and we're only recognizing this now. And what's concerning to me is that although the more serious symptoms are rare, things like blood clots, dementia, strokes, these are very concerning, even though they're rare. And some people are saying even psychotic symptoms. So having paranoid delusions of people coming after them, or people presenting with psychiatric symptoms for the very first time in their life, in their 40s, who are otherwise very high functioning or didn't have any psychiatric problems.
Shepard Smith here. Thanks for watching CNBC on YouTube.